40% of the way through, for those of you who are baseball fans, considering about top of the fourth inning. So you should have some questions already. So if you don't ask questions, I'll just call on you. So start thinking about your questions. You might have tweeted them already. Get them ready for our next presenter. So Allison's going to come up. She's from Infield Health, and she's going to talk a lot about mobile technology. Alison Pilsner. And by the way, Alison came in all the way from Denver for us tonight.
He told me he was going to embarrass me. Worse than that. Alright, like he said, my name is Alison Pilsner, and for those of you who don't know me or didn't get the memo, I did move to Boulder, Colorado from Washington, D.C. And I am now happy to say I am working here in D.C. with Infield Health, combining two of my great loves, healthcare and mobile technology. So the title of my presentation, Think Global, Act Mobile. We're going to do a little interactive exercise. How many of you have one mobile device? Raise your hand. How many of you have two? How many of you have three or more? And how many of you are using them right now when I'm talking? Tweeting positive things, I hear. Alright, so I'm actually not here to talk about any of the really cool and awesome things we're doing at Infield Health. I'm here to talk about how mobile technologies have impacted the developing world, health awareness, behavior change, education, etc. Some of you may have heard about some of these projects before. However, we always hear, man, when they're just getting started and getting revved up and it's really exciting, but we don't always hear how these stories end or how these stories successfully continue. So that's what I'm here to talk to you about today. Alright, so why is mHealth so important? What is mobile health? So, mobile phones reach further into developing countries than any other technology and health infrastructure. As you can see here, there may not be any other technologies, no health infrastructure, but people still have mobile phones, even in the developing world. Some of you may have heard the statistic that there are more mobile phones than toothbrushes, toilet seats, and even people, which you all demonstrated here tonight. And that also, we are in the United States of America, but that also translates into the developing world as well. Okay, so how is mHealth used? These are some of the common ways that mobile health or mHealth is used, but I'm going to talk about a few of my favorites that really did inspire me to begin a career in mobile health right here in my own backyard. I'm going to talk a little bit about supply chain, remote diagnostic surveillance, and if I have time and don't talk fast enough, distance learning. So first up is SMS for life. So text messaging can seem like a really small and simple thing, but in Tanzania it's fighting a great battle, and that battle is malaria. So does anybody know how many children die a day from malaria in Tanzania? Any guesses? Well, it's 1 every 30 seconds. Which, unfortunately, the situation is even more sad because malaria is an extremely treatable disease and medications are available. The problem is these people walk by foot, barefoot most of the time, days, hundreds of miles to get all the way to the clinic with their sick child to find out that these medications, they ran out. Where did they go? They were delivered, nobody knows. So this is a really big supply chain issue, and mobile health has helped this issue. So to combat this problem, Vodafone partnered with IBM, Novartis, and the Ministry of Health, as well as Rollback Malaria to develop a solution called SMS for Life. It's actually really simple. So every week, health facilities are reminded via SMS text messaging to check their supply of anti-malaria medications. So if they're out, the health coordinators in the area at the Ministry of Health can actually then go and see who's running low, and they can distribute more medications as necessary. So thanks to this program and using mobile solutions, the number of clinics running out of medicine was reduced from 90 to 6% during the 5-month pilot in September of 2009, which is why I said many of you may have heard about this project 3+ years ago. But due to its success now, the program is now being rolled out to all 5,000 health facilities across Tanzania. Pretty impressive. And the next project I wanted to illustrate, one of my favorites, is Child Count. And Child Count is an mHealth platform developed by the Millennium Villages Project to improve maternal and child health in Kenya. It uses the rapid SMS platform to really coordinate the activities of community health workers across the country. It's also really simple. So what a health worker will do is they may take blood measurement, etc., whether it be for malaria, malnutrition, whichever. And they can actually text in via mobile phone the results to confirm whether or not it is malaria, it is malnutrition, and what types of medications to give the children. So transmission times that previously took from 2 to 3 months were actually reduced to an average of 2 minutes utilizing this mobile technology. Also very impressive. Lastly, quickly, ComCare is a very impressive mobile open source platform. It utilizes a low literate interface to use audio clips and images to reinforce each prompt while teaching healthcare workers in India. So it really empowers these women in India. And by empower, I mean 750,000 plus accredited social health activists, or as we call community health workers, to provide life-saving interventions for their communities. Also, really impressive. And, in closing, like we all know, and if these 2 examples didn't already demonstrate it, mobile communications really does offer us a new means to support populations all over the world, regardless if they have roofs over their heads, shoes on their feet, they have mobile technology. So how can we learn from these examples and even more to implement these strategies right here at home, here in DC and abroad. So thank you so much for your time.